So I'll call this meeting to order, the City Council meeting of April 21st, 2020. Madam Clerk, would you please call the roll?
Councilmember Cordero?
Here.
Councilmember Moats?
Here.
Councilmember Soto?
Here.
Councilmember Waterfield? Here. And Madam Mayor Patino?
Here. The first order of business is a proclamation, and Councilmember Waterfield will be making the presentation.
We need to do the protocols.
This proclamation is something that is very near and dear to me. It's in regards to the National Day of Prayer that was signed into Congress in 1952. Whereas National Day of Prayer is an annual event established by an act of Congress which encourages Americans to pray for the nation, its people, and its leaders. And whereas days of prayer have been called for since 1775, when the Continental Congress designated a time for prayer in forming a new nation. And whereas in 1863, Abraham Lincoln called for such a day. And whereas officially, Day of Prayer was established as an annual event by an act of Congress in 1952 and was signed into law by President Truman. And whereas the law was amended in 1988 and signed by President Ronald Reagan, establishing the Day of Prayer as the first Thursday of May each year. And whereas Day of Prayer belongs to all Americans and every American may observe the day in his or her own way. And whereas Protestant, Roman Catholic, and Jewish leaders are included in Day of Prayer events celebrated in Washington, D.C. and throughout the nation. And whereas the city of Santa Maria is celebrating its 23rd annual Day of Prayer and continues to be the largest assembly of Protestant, Roman Catholic, Jewish leaders and participants in the state of California. Now therefore, Alice M. Patino, Mayor of the City of Santa Maria, hereby recognizes the 7th day of May 2020 as a Day of Prayer in the City of Santa Maria and encourage people of all faiths to participate in Day of Prayer according to their own traditions. And Madam Mayor, I just think that it is just so very important and vital in what's going on today that this National Day of Prayer is recognized, and I thank you very much for continuing to do so.
And you know, and you know, you've been there at when we have the National Day of Prayer and how many people come out, and maybe you just see them that one time once a year, but they're there.
Yeah, you do see a lot of them, you know, just that one particular time, because they're all faced there, and everyone just comes in to worship and just to give thanks, and I just think it's just a wonderful testimony to so many people.
Thank you very much. And Madam Clerk, would you like to make an announcement on the protocol for this evening's meeting?
Yes, Madam Mayor. Pursuant to Section 3 of Executive Order Number N2920, issued by Governor Newsom on March 17, 2020, this regular meeting of the City Council will be conducted telephonically and broadcast live on the city's website and on Comcast Cable 23. Please be advised that pursuant to the executive order and to ensure the health and safety of the public by limiting human contact that could spread the COVID-19 virus, the City Council chambers will not be open for the meeting, nor is City Hall open to the public. Some guest speakers will be participating remotely. If you're watching the live stream of the City Council meeting and wish to make either a general public comment or to comment on a specific agenda item, please click the link provided on the published agenda to register for the meeting webinar and participate live and provide your verbal comments. Once logged in the questions box, provide your name and the agenda item you wish to speak on. If there are additional items of interest you wish to speak on, raise your hand in the webinar portal. Once the comment period for the item is called, your microphone will be unmuted. You'll have 3 minutes to speak or a limit at the discretion of the mayor. For staff and guests participating remotely, please use the raise your hand feature in the Zoom meeting to be acknowledged to speak. All attendees will be muted until it is your opportunity to speak, and then please state your name for the record and for the listening audience.
Thank you. The next, we have a presentation, a proclamation, and Councilmember Soto will be making this presentation.
Thank you, Madam Mayor. The proclamation is for Library Week.
Whereas the theme of National Library Week, Find Your Place at the Library, was selected before anyone knew there was a global pandemic, and whereas the City of Santa Maria Public Library is open for business during the current pandemic, offering phone and email services to the community, and whereas the City of Santa Maria's Public Library's virtual library is open online 24/7 and provides a rich variety of services for children, teens, and adults, and access to ebooks, movies, music, games, virtual story times, activities, and more from the comfort of home. And whereas the staff of the City of Santa Maria Public Library have helped the community during the current pandemic by answering 1,049 phone calls for emergency food between March 28th and April 6th in partnership with the Santa Barbara County Food Bank. And whereas when the community eventually returns to normal, the City of Santa Maria Public Library will reopen and continue to meet the needs of the community through enhanced collections, through thoughtful programs and outreach services, including an ebook mobile that will who will bring the library to those who cannot travel to the physical building. And whereas librarians are trained professionals and help people of all ages and backgrounds find and interpret the information they need to live, learn, and work, especially during difficult times. Now, therefore, the Mayor, Alice Patino, hereby recognizes April 19th through the 25th as National Library Week in the City of Santa Maria and encourages our residents to find their place at the library by visiting the library online to explore and engage with the many services available from the comfort and safety of their home.
Thank you. It's really sort of nice that our librarians now realize they have another skill, answering the phone and taking, and a lot of those requests that come across the phone are for the food bank and for the food in Santa Maria. So they play such an integral part in what we're going through right now. People are probably, what do you call it, working out of their category or whatever it is that they're doing now, and it certainly is appreciated. Next, we have another proclamation, and Councilmember Moats will be making the presentation.
Thank you, Madam Mayor, and this proclamation is to Donate Life Month. Whereas organ tissue, marrow, and blood donations are life-giving acts recognized worldwide as expressions of compassion to those in need, more than 112,000 individuals nationwide, more than 21,000 in California, are currently on the National Organ Transplant waiting list, and on average 17 people die each day while waiting due to the shortage of donated organs. And whereas the need for donated organs is especially urgent in Hispanic and African American communities, more than 600,000 units of blood per year are required to meet the need in California, and there are 18,000 patients in need of volunteer marrow donors. And whereas a single individual's donation of the heart, lungs, liver, kidneys, pancreas, and small intestine can save up to 8 lives. Donation of tissue can save and heal the lives of more than 75 others, and a single blood donation can help 3 people in need. And whereas millions of lives each year are saved and healed by donors of organs, tissue, marrow, and blood, the spirit of giving and decision to donate are not restricted by age or medical condition. And California residents interested in saving a life through living kidney donations are encouraged to visit www.livingdonationcalifornia.org for more information. And whereas Santa Maria residents can sign up with the Donate Life California Registry when applying for or renewing their driver's license or ID cards at the DMV. Now therefore, Alice Patino, Mayor of the City of Santa Maria, hereby recognizes April 2020 as Donate Life Month in the city of Santa Maria and encourages residents to check yes when applying for or renewing their driver's license or an ID card, or by signing up at the donatelifecalifornia.org or donevidacalifornia.org. And of course, I recommend that people do that. My sister had a liver transplantation, which took her from a very poor lifestyle to one where she was able to normalize herself for many years.
Thank you, Dr. Moats. I know we always have people coming to the podium every year telling how that has impacted their life. And when Bob Orrick was sitting up here at the dais, he would always encourage people to sign up for that on their driver's license, always, because he would make sure that, he checked the box there. He didn't know he was going to have anything left to give, but he was there and ready, so. Thank you very much. The next item on the agenda is the public comment period. Madam Clerk, would you please read the criteria for the public comment portion of the agenda?
Madam Mayor and council members, staff, wait a minute, wrong section. Our whole agenda has changed up. Okay. If you are watching the live stream of the city council meeting and wish to make either a general public comment or to comment on the specific agenda item, please select the link to register to speak in the agenda posted online. You will be limited to 3 minutes to speak, or as directed by the mayor to speak by registering your name and identifying what agenda item you wish to speak on by raising your hand within the remote program, Zoom. When it is time to speak, your microphone will be unmuted for the time allotted and will be muted upon completion of your comments. This time is reserved for comments on public consent items or within the subject matter jurisdiction of the city council, not otherwise on the agenda.
Madam Clerk, do we have any requests to speak? Or written communications?
No raised hands at the moment, but I do have some written communications to review. Madam Mayor, City Council members, the staff received 2 written communications for public comment from Kathleen Grace Velasquez asking the county be opened up and the shelter-in-place order be lifted, and also requesting local agency officials to submit letters to Governor Newsom, and from an anonymous resident asking the city council to place a moratorium on small cells and other wireless infrastructure permits until the COVID emergency is over. These written communications were previously emailed to the city council, posted on the agenda's city website, and copies have been provided on the dais. Madam Mayor, is this the time you wanted Ms. Lopez to speak on her item?
I don't know. How do you have the, Mr. Silva, how do you have the program arranged? I asked Ms. Lopez from the high school district to speak on the item from the high school district.
For the COVID presentation?
Yes.
Okay, so wait till item 4. Okay.
Okay. Thank you. So moving on, did you have any comments? Okay, moving on to the consent calendar. Madam Clerk, could you please read item number 3?
Routine items are presented for city council approval without discussion as a single agenda item in order to expedite the meeting. The consent calendar is approved by roll call vote with 1 motion. These items are discussed only on the request of council members.
Does anyone have items they wish to pull for discussion? None? No.
With that, not seeing any, Madam Mayor, I'd like to go ahead and make a motion to approve the consent calendar.
Second.
Okay, I have a motion and a second to approve the consent calendar. Any further discussion? Okay, Madam Clerk, can you please call the roll?
Councilmember Waterfield.
Aye.
Councilmember Moats.
Aye.
Councilmember Cordero.
Aye.
Councilmember Soto.
Aye.
Madam Mayor Patino.
Aye. Okay. So next, I believe, Mr. Stillwell will get an update on the coronavirus situation. And I got a comment and then from a person, and then I got an email, and they really liked having the updates that we have at each council meeting. That gives they listen to what's going on in New York City, and it's completely different than what's going on in Santa Maria, California, so they were very appreciative of that, and they thought that we had covered quite a bit. So anyway, you're next.
Well, thank you, Madam Mayor, and we appreciate the opportunity to bring the information forward. As you say, there is a lot of, there is a lot of news out there, and there isn't as much news focused on Santa Maria as we wish there would be. There is a lot of specific information we have that we're pleased to be able to present. Tonight, the focus, again, will be on the public health, and we have Sue Anderson and Dr. Ferguson here from Marion Regional Medical Center. And we'll have Chief Champion, our fire chief, be able to discuss the coordination effort that we have in the city. And then also tonight, we have a focus on the recovery and the reopening process. And we have Glenn Morris from the Chamber of Commerce, Janet Silveria from the Community Bank, and Terry Billups from the Small Business Administration to be able to discuss funding to maintain for the relief of the current businesses and then the recovery efforts we're embarking upon. And then, as you mentioned, we have Ms. Lopez to be able to comment as well, and we can take that at the beginning or at any point during the middle of this process, of the presentation.
Okay. Do you want to do Ms. Lopez first? Okay.
Ms. Lopez?
Yes, I'm here.
Okay, Madam Mayor and council members would like to hear from you now.
Thank you. Good evening, Madam Mayor and honorable city council members. Yesterday, our district, Santa Maria Joint Union High School District, sent out a letter to our students, parents, staff, and to the community in general. I wanted to give you a brief overview and summary of the contents of that letter. We, the district, would like to thank the community for your cooperation, patience, and flexibility during this time of the COVID-19 crisis. As you are aware, Governor Gavin Newsom issued a stay-at-home order for California that extended our school closures through the end of the school year. Everyone is required to stay home except to get food, care for a relative or friend, get necessary health care, or go to an essential job. And we encourage everyone to continue to follow the guidelines to stay safe. We ask that you please be patient with the district and the school sites as we progress through this health crisis. You can find updated information on our webpage at Santa Maria Joint Union High School District on the COVID-19 responses, which includes information on remote learning resources, tech hotlines, free meal information, facts and preventative measures for COVID-19, and other resources for students, parents, and staff. If you go to our webpage, on our homepage, it's really simple. There's red writing right on the front page that mentions COVID-19. And if you just click on that, it'll take you directly to these resources. Even though our school facilities are closed for the remainder of the school year, our commitment to distance learning continues. Plans for semester 2 grading and credits have been developed and posted on the website, and information on graduations and other end-of-the-year events will soon be sent out. Our thoughts and prayers remain with each and every one of you. Please contact our school sites or the district office directly should any need arise or if you have any questions. Again, we thank you for your patience and your support during this time.
Thank you very much, Ms. Lopez. Any questions of Ms. Lopez at the time? Okay, thank you very much for being here. Appreciate it.
Thank you.
Bye-bye. Okay, Mr. Silva?
Yeah, I think we want to start first with Dignity Health representatives to be able to get an overview of the public health situation, and then we can explain how we're coordinating those efforts and looking forward to recovering and reopening.
Okay, if any of you have questions, and if you can just write your questions down, and at the end of Ms. Anderson's presentation, then we can ask. Thank you.
Is this turn on? Yeah. Thank you, Madam Mayor and City Council. I'd like to thank you for letting us come the last few weeks and give you updates on what's happening at Marion Regional Medical Center and what's happening with COVID in the community as we see it. I also tonight want to thank Chief Champion because he and the Santa Maria Fire Department stepped up. They asked to do a barbecue to thank the frontline workers at the hospital. It's going to happen Friday, and I think it was, I doubt that he ever envisioned that it would be 1,500 lunches and dinners that he'd be putting together, and great support from the community to help with that. So it's really going to be a fun day on Friday. We hope around noon, when the bells ring out to the community from churches and from our bell tower, we hope to have fire trucks there and other first responders be a part of the whole thing. So it's going to be a fun day on Friday, and we really appreciate you guys for doing that. It's going to mean so much to the healthcare workers. That said, I also hope that you all got a chance to read both the LA Times this weekend and the Santa Maria Times, because there was a story, there's an ongoing story of Mr. and Mrs. Meza in there. And I really think that shows the tremendous medical staff we have, the tremendous caregivers we have in our community. I was so proud of our facility and our team, and it really showed a lot about what's happening here. I'm going to turn it over to Dr. Ferguson, because he's been on the front line here with lab testing, which has been a big thing with us, but he's also been on the front line of trying to organize the blood plasma. As you know, that's kind of cutting edge right now. And with Mrs. Meza, I think like it said in the paper, we were part of giving her blood plasma, and also some other cases that are really heartwarming. And physician in another state got some plasma from here that we were able to give them. So anyway, I'm going to turn it over to Dr. Ferguson to really give you some of the highlights of all of that and what's happening on the testing side.
Thank you. Thank you very much, Dr. Ferguson, for being here this evening.
Okay, thank you, Madam Mayor and council members, Dr. Moats. So, it really has been a difficult time for the community. And so I think that the proclamation that you read regarding organ donation was timely, because you've been hearing about plasma donation, and that's what helped Ms. Meza. I've had the opportunity to get to know Mr. Meza. We talk on the phone almost every day. For those of you who don't know his story, they both had COVID-19 and were in the ICU at the same time. He recovered, she got worse. It turned out that a new experimental treatment, convalescent plasma, had come available, and that's where you take the blood plasma from someone who's recovered from COVID-19, and you give that to a patient who it maybe needs it. And it's not known whether or not that helps alone. Obviously, all of these patients get other therapies, but it's something that we wanted to try with Ms. Meza. So we went out to try and find a match, and it turned out that her husband, Mr. Meza, was a match. So we thought, oh, this would be fantastic. The problem was we couldn't get his blood ready in time. So we had to scramble, and we found another match at a sister hospital at St. John's in Oxnard. And we were able to work out a deal where we would take that person's donation and then later get a donation from Mr. Meza to put in the bank to help someone else. So during this process, we really got to know one another, and we were able to get the plasma and give it to Ms. Meza, and everyone has read her story. She's done much better. She got some other therapies as well, ECMO at St. John's in Santa Monica, and lots of people were involved with her care. So it was really a community and team effort, lots of people involved. As you guys know, he's on Facebook a lot, and he told me he had people praying for him on 3 continents and all of that, and it was really wonderful to get to know him. During that process, other individuals reached out. We, quite by accident, due to Hardy Diagnostics antibody tests, they decided to drop a few off. We tried them out on some of our staff members, and we found a staff member who had actually contracted COVID a couple of months ago and had recovered and had antibodies. So we were actually able to get a donation from her, and we froze that plasma and we put it in our freezer and thought, okay, maybe we'll use it. Lo and behold, the phone rang and said, hey, that plasma that we gave you to help Ms. Meza? Would you mind giving us some of this person's plasma? And so this was all happening last weekend. So, each person who donates, they can get 3 or 4 treatments to help someone else. And so we gave away all 3 of those last weekend. One went to help an ER physician who contracted COVID while working at one of our sister hospitals in Las Vegas. He, with only convalescent plasma, recovered in 1 day, and 2 days later was on room air and was actually able to leave the hospital, which was tremendous. We were able to help another patient in Antelope Valley who was really not doing well. received a donation and recovered, and he's now breathing and talking with his family members. So, and the third one is going to be administered down at St. John's in Oxnard. That was the payback. So it's been really exciting to watch this, to get to know some of the community members who have recovered from COVID-19. They've all been willing to donate, and so that's been exciting. So it's been a huge community effort. So I want to take this opportunity to thank the members in the community who have recovered, and for those who want to donate, to contact our physicians. And we are gladly accepting donations through our blood supplier, and we can help facilitate that process at Marion. If there's time, I can give an update on testing at Marion Hospital. So when this started, as you know, we are somewhat isolated. So it was difficult in the early days to get testing for the community, but we scrambled and were able to get testing through some of the commercial laboratories. A lot of tests went to Quest, LabCorp, outside the area, but we knew that we were going to need to get testing here as soon as possible. As you've all read about, the commercial laboratories were overloaded with tests and began to melt down, and we started to see really long turnaround times to get testing back. So with the support of Marion Medical Center and Dignity Health, we were able to get testing established at Marion Medical Center. So as of last week, we're actually able to perform the bulk of our testing on symptomatic patients at Marion. We have 3 PCR platforms that are in operation that are involved in diagnostic testing. We are currently in a partnership with Hardy Diagnostics, a local company, to evaluate their antibody test. And we just brought up a second antibody test from Abbott Diagnostics. We just brought that in today, actually, as we speak, and we'll be evaluating that. And what I want to get across to everyone is that, all of these testing modalities are available right here. We are studying it aggressively, and we're tracking each and every positive case. We're in very close communication with the Santa Barbara Public Health Department. We're involved with, here, as well as the County Board of Supervisors, to make sure that all of these things are available. Tomorrow, we'll be reaching out to the Marion Foundation for some support to kind of fund the research aspect of this. And people go, well, why, what is the research aspect? All of the testing platforms that we use were released emergently by the FDA, which means we don't really know how they perform in the community. So it's important for us to take a close look. Everyone I've asked to volunteer to do some unusual thing, maybe take 2 nasal swabs instead of 2, or instead of 1, has gladly agreed to do that. And it allows us to get the latest information so that we can help as many people as possible. So I definitely want to get across to anybody on this committee, and if you know people who donate to the hospital, that's what the big push is right now, to make sure that we can offer the latest testing to everyone in the community.
Yes, Ms. Waterfield.
So tell the audience what the process for the antibody testing consists of. If someone says, I want to know if I am fit to be able to donate the plasma, what do they have to go through? And do they have to have had the COVID-19 first to be able to do that?
Okay, that's an excellent question. First of all, we love blood donors, okay? So if you want to donate blood, please donate blood. But as far as convalescent plasma, which is what we use to treat people who are suffering from COVID-19, you do have to have had the disease. Now, a lot of people will have had an upper respiratory tract infection or a COVID-like illness. We need it to be a PCR-confirmed, molecular-confirmed case. And so we can help individuals work through that. As the antibody tests become more available, there are going to be people who have recovered from an influenza-like illness who have antibody tests positive. We currently don't know if that plasma can be accepted or not. So in this case, because it's so experimental, we really want people who have had documented PCR COVID. And then we'd like to collect their plasma after their PCR test is negative. So Mr. Mays will tell you, sometimes we'll have to sample you multiple times until you clear. And so we're able to help people through that process. Now, there's lots of questions about the antibody test and what does that mean? And if you have antibodies, do you have immunity? The answer is we don't know yet. And so this is something that's currently under investigation. You might be reading about individuals who have antibodies and then contract COVID again. So that's why the research is so necessary. We do have the antibody test. It's not something we can offer clinically yet. It's something that is more in the research realm. And you will find individuals who have antibody test results who we've tested, and you'll hear about whether or not they had antibodies. But right now, it's still a research tool.
Okay, so those that just go into the Red Cross and give blood, the Red Cross will determine whether or not your blood is a match for somebody else and those types of things?
Yes, so
Okay.
our blood supplier in this area is Vitalant, and there is on their website, and we'll also make some information available, perhaps at the next meeting, I can bring some information as to how you can donate convalescent plasma if you have recovered from COVID-19.
Fantastic.
Yes, Dr. Moats?
Dr. Ferguson, are the admissions to Marion Hospital for coronavirus going down? Are we plateauing? Are we going down on this curve?
Yes, so the shelter in place was highly effective. We were starting to see a rise in cases about 2 weeks ago, and we were able to flatten that curve, and now the cases are going down. Not just hospital admissions for COVID-19 are way down. Acuity is also more favorable, it's better, patients are healthier, and we're also seeing fewer positive cases in the outpatients that we're screening. So yes, the shelter in place was very effective.
We were originally worried that there'd be a lot of beds necessary for persons becoming infected with this virus, but it appears that people overstated the need for those beds. And what's the capacity at Marion now for beds for people with coronavirus? Plenty of them?
Right now, but what I would say is that I don't think that there was an oversupply. And so it's interesting, if you look at the rise, there was a sharp inflection, like I said, a couple of weeks ago. And had that exponential, had we not sheltered in place and we saw that exponential curve, we would have come up against our ICU and COVID bed capacity. So for a while, it looked like we were going to get there. But as cases began to flatten, level off, and then go down, and we were able to get patients out of the hospital, we didn't have a problem. I would say that in, having lived through this, the real game changer was never having more critically ill patients than our ICU physicians could take care of. So they were able to give complete attention to each and every one. You might have read that one of our ICU docs went down into accompanying a patient during a transfer. As soon as proning, which is flipping people over, became effective, we were able to do that. So we never had more patients than we could manage, but you could see on our morning briefings, and we were meeting every morning, if that number continued to grow, you can't give that same level of attention and resources to each and every patient. So we never had to have people share ventilators, for instance, or we never had to manage resources, give them to one patient and not another. We fortunately didn't have to make those decisions, but we could see where if that exponential rise happened the way that it was starting to happen, we would have been there.
And my last question is, during this epidemic, the hospitals were told to defer elective surgical procedures such as joint replacements and such. Will that situation change now that it looks like we've got the viruses, or that things are looking a little better, and there's maybe more bed space and more protective personal equipment to go around? Are we going to? I know that hospitals' income is greatly dependent on procedures that can no longer be performed in the operating rooms. What's the situation on that now?
It's funny, it's timely. I was on a conference call right before this meeting discussing just that type of thing. So the way we sheltered in place was very, it was unprecedented. And the way that we come out of it is also going to be, a little unusual. So there's a lot being written in the medical literature about how to reopen, how to get to a new normal, and how to tier elective surgical cases so that we can, some of these cases, as you know, Dr. Moats, are not all that elective, right? So there's some things that need to be done. Urgent cases we've continued to do, actually, even during the shelter in place, we've continued to do urgent elective cases. A lot of cancer cases we continued to do. Things like endoscopy procedures and cardiology procedures, we're going to start to open that up a little bit more over the coming weeks. We need to have the federal government put out some really nice guidelines about how to phase back in and to use real-time indicators to determine when you might need to restrict things a bit in order to save PPE, in order to save hospital beds, and when you can loosen. And so that's what we've been determining, coming up with a scoring system to figure out which cases can be done and how to gradually reopen so that if we do start to see a rise in cases, we can maybe back off a little bit, conserve some resources, and if it stays low, we can open up a little bit. So that's what we're in the process of doing right now. Thank you.
Ms. Soto?
Thank you, Madam Mayor. I have a question regarding costs. So a lot of folks have asked me, will I get charged for a COVID test at Marion? If I have to receive care and I don't have medical insurance, or if my deductible is too high, how will I be able to cover those
So
expenses?
the COVID test, Dignity Health has agreed that any patient's copay and all would be waived. They'll do that on the back end on the bill. I really don't think anybody should worry about that. We will take care of them one way or the other. If they have any issues, they can contact us, but that really, we're trying to take care of it and let people come in and get their COVID testing without having any out-of-pocket cost.
Great, thank you. And then another question that I have is regarding data. It's challenge. I mean, I've heard conversations within county public health officials about starting to release like aggregated data of those who of patients who are COVID positive. That way we have a better understanding of who has been mostly impacted or who has been actually getting tested and where the pockets may be.
And I think part of what Dr. Ferguson would tell you is that the testing's been a little slanted because we've only been testing those that really have a reason to be tested. You're going to see a higher incident of actual results that are COVID positive. And even with that, the percentage is only 5%, yeah. So really, we think the prevalence of it in our community is going to be very, very low once we start expanding the testing to a much greater extent.
Well, will the county or will medical officials be releasing again demographics, like data on like demographics of who is testing positive?
Yeah, I can speak to this a little bit. So we have tracked each and every single case that's come through the Dignity Health system. Cases that are outside of our system are tracked by the public health department, but it can sometimes take time for those results to come back, particularly if they're tested outside of the area. But we think that we're getting a really good snapshot of what's happening in Santa Maria, right down to the zip codes where they pop up. We have little heat maps that come up. The cases, again, have leveled off a little bit, and so we've been working very closely with the public health department to talk about how we can use this real-time data. That's what's going to let us open up our surgery centers and elective procedures and that, and ultimately our city, because we do have the ability to pinpoint these cases. One of the things I was reading about is that this pandemic is going to turn into mini epidemics. And so instead of seeing a sharp exponential increase, we're going to see mini peaks. And our ability to find out where those are in real time, that's what's going to keep the community safe. So we're definitely, I'm passionate about this. I'm a blood and bone marrow pathologist, but when this happened, I could tell that there was a need to try to figure this out. So we channeled all of our resources into figuring out how we can do this for this community. One of the wonderful things about, I've been here for 17 years, and one of the wonderful things about being here is that we do have a very tight network of healthcare professionals, public servants, and they're always talking all the time. And so it's allowed us to respond to this very quickly.
You know what's so great about what you guys have invented is that you've just made a map of where these hot spots are within the city of Santa Maria. So the next time you see, a flu virus come around, you kind of know which areas to target first and to get information out to those that would need it more and how to avoid, staying away from the virus or just doing certain things in their own family homes and different things like that. Because those pockets that you're talking about are very important to see where this virus is coming up.
Yeah.
That's great.
Dr. Lopez, let me ask you again about the demographics that Ms. Soto questioned about. What are the age groups that are getting this? Sex, ethnic background? I'd be curious.
Yeah,
Does it strike a particular segment of our community?
Absolutely. One of the things that's fascinating, and it's a blessing, but for some reason, our children don't seem to be, I mean, there are children that get it, and there, unfortunately, some children who've actually passed away from it, but for the by and large, it tends to be a very mild illness if it affects them at all. The most vulnerable populations are those over 60, if there's any comorbidities, COPD, smokers, those it can be more aggressive in that population. It can affect adults at any age. So we have had some young patients in their 30s and 40s have difficulties with COVID-19. 80% of people, it'll be a mild illness and they'll recover just fine. 20% of people who get COVID will require some type of hospitalization or intervention. And so that's what's somewhat unusual about it. We've seen in this particular community, people who, have continued to gather anyway. I mean, we've seen sadly outbreaks that have been associated with gatherings, particularly early on when individuals didn't know. I think there's been some challenges with social distancing and people that live in close quarters that don't have spaces to really do that. We've seen a lot of household transmission, so if you're in a house, we've seen families get it. It's a much more challenging situation in the Latinx community, in the African American community. Some of that we believe might be genetic, some of it might be comorbidities, but it's been a bit of a challenge. I'm sure you read nationally that deaths in the Hispanic population, the African American population, they tend to be a greater proportion. The wonderful thing about Santa Maria is we've had one death.
We had actually a transfer from another hospital that ended up dying right away.
But in our community of the individuals that have been infected. So fortunately, we've been able to intervene, and that's where the social distancing and the things that we've done that have allowed us to really pour resources into those individuals to allow them to have the opportunity to have the best outcome has really made the difference. So one of the neat things about our experience here and our demographics are that we don't see of the Latinx patients who have been affected with COVID, we've been able to take care of them and get them out of the hospital, and that's exciting. So I think this is an experience that can be shared. Not yet. Yeah.
Mr. Cordero, you have a question?
Thank you, Madam Mayor. This is more of a comment, probably for Sue. We have in my family a very, very, very close person that's currently being treated and been treated at Marion, Leon, in the in the ICU. And I noticed this actually 7 years ago when my wife was treated for cancer, but it's so important. I get a report at least once, if not twice a day on Leon's condition. And I could only get the depth of this report if because of the information that his wife is getting from the hospital. So I say that to say this, and it's that you're not really treating just the patient, you're treating the family. And I think that means a lot to our citizens, and I know it meant a lot to me. So I thank you for that, and I thank you for what you're doing for this family in town, because Leon is close to dead. And it means a great deal on how he's being treated at Marion. Thank you very much.
Thank you very much for that. And that's the terrible part of this is, we can't allow visitors, so we've had to come up with a whole new way to communicate with families. I feel so bad for families when your loved one's in the hospital and they're not doing well, and here the only communication you get is over an iPad or something. But it has been pretty amazing how caregivers, and even Dr. Sadhu, when he went down in the ambulance with Mrs. Meza and was on the phone to her husband several times on the ride down to give him updates on how she was doing, and then they, had an iPad that she was able to talk to him through. So it's things like that. We've changed the way we're communicating, and, you know, hopefully we'll get back to the human touch where you can have visitors and everything. But for right now, I'm really proud of our whole team that we've kind of put together to make sure that the families are communicated with, because it's not easy today.
Well, I can tell you that Marion is doing a great job at communicating with Leon's entire family. And that communication, by the way, goes statewide. The family is huge.
Well, that's really good to hear. We'll say a little prayer for Leon.
I look for those little messages, and they're not little, you know, as
Yeah.
the text message goes, they're like long, and they're always uplifting on his progress, sitting up, the ventilator issues, things like that. So I think Marion's doing a great job at communicating that to all of us.
Thank you very much. And, you know, I think it shows, you know, to go back to your question, how many beds do we have available? Right now, we have, you know, over 100 beds available. I mean, we really planned well. Our whole team, Dr. Ferguson, all the intensivists, all our hospitalists and everything, really put together such a great, you know, program whereby how we handle the COVID patients. And, you know, that's the message we want to give to people, too, is you shouldn't feel scared to come into the emergency department. We find right now that people, the other effect that it's had on people is that they're waiting sometimes till their appendix is about ready to burst. Or we had a gentleman who thought he had a heart attack, and he'd had signs for several days, but he didn't want to come in because he was afraid he'd get COVID. And I just am here to tell you that we have processes in place. We don't, you know, if you're suspected of having COVID, from the minute you walk into our ER outer area, we have a separate place for you to go, a separate process. You don't have to worry about that. We're ready to take care of you in our emergency department, and we have plenty of beds right now to take care of the public. I think we planned well. I'm proud of what we've done, and I think we're proud of the community too, because number one, the outpouring of support from the community, but also the shelter in place has made a difference. It really has. We have been very fortunate in this community. So, thanks.
Thank you.
Thank you.
Mayor, I'd also
Yes,
like to
Mr.
know if
Cordero.
we could get just a slight overview of how we're doing in the city from maybe Mr. Stillwell with regard to the city employees and their families. Do we have huge numbers, small numbers, any numbers at all?
Thank you, Madam Mayor. Councilmember
Okay,
Cordero. Yeah.
before you give your report, I just wanted to make
Sure.
some comments, and you asked about demographics. Today at the Board of Supervisors, they gave a lot of that information, and they will have more information. But if you watch the press release on every afternoon at 4:30, have you been watching? Okay, and they come out with that information. But I think what's interesting is that when you see the categories from like 30 to 49 years old and from 50 to 69, that's the greatest amount of people. And when you go into the grocery store, those are the people I see without a mask on. And that's not scientific, but these are also the people that are going to work. So we live in a community that has so many essential services, and these people are working. And then on top of that, we have a lot of families that live together. So when someone asked the question of the Board of Supervisors to Dr. Reynoso, she wasn't sure why, but knowing our community the way we do, it's not scientific. But it seems to me that we have that. But, you know, you see people, and I commented, I see people driving in a car by themselves with a mask on. Now, that's real dedication, because these things are not comfortable. But this weekend, I always go by the parks, and you see maybe a couple or two, or a couple with their children at the park, and this is why we know we wanted to keep our parks open for families to enjoy. So once we took the basketball, the backboards, and the hoops down, it certainly helped a lot. But you know, I know I've gotten emails, I've gotten phone calls, and people criticize Santa Maria and the residents and say we're not doing what we should be doing. I got a letter from a lady saying that nothing has changed downtown. People are still running around downtown, and I'm thinking, you can speed down Broadway because people are speeding past me, and I know I was going over the speed limit, and they were by far going faster than I was. So, if you drive those streets every day, then you know there is a difference. And you probably see it a lot coming from the hospital, coming into town. But, thank you so much for being here, because people get so upset when they hear what's happening in New York. And then we know that, I think the governor is making a lot of his decisions on what happens in San Francisco and Los Angeles. But this is Santa Maria. And I'm very proud of the citizens here and what they're doing. So, anyway, go ahead, Mr. Cordero.
That was it, I was just waiting for...
Okay. Go ahead, Mr. Stilwell.
That's probably a good segue to the next portion of the presentation, if there aren't additional questions of the Dignity folks.
Yeah.
So, we're fortunate here, as you hear, to have excellent medical science, and I want to acknowledge how this ties into the recovery effort moving forward as we transition to Chief Champion. So the medical expertise from Marion, including Dr. Ferguson and Dr. Ritter, along with Cal Poly and the San Luis Obispo health officials, have established a medical criteria that can serve as a basis for us moving forward. We obviously have the regulatory framework with the federal government, the state government, and county public health. And then the mayor's launched the Mayor's Recovery Advisory Team, which we're fortunate to have Sue Anderson on that, Jay Hardy, retailers, chamber members, nonprofits. So it'll be nice to be able to use the science that you heard tonight with the framework of the regulations that are in place of how we are able to move forward in this different environment going forward. And so we'll talk a little bit more about that with Chief Champion has a little bit of the framework in addition to the coordinating efforts and the question that, or the answers to Dr. Cordero's question, and then Glenn later, or Mr. Yeah,
Close.
We got a lot of doctors here. And then later we'll have Glenn Morris, and specifically with chamber folks, talking more about those steps moving forward and how we're currently helping our businesses and helping them then moving forward.
Do you know, Mr. Stilwell, I have a question of Ms. Anderson. Do we have any of the patients from the prison in our hospital? That was a question I was wondering.
We do not. Most of those patients have gone to Lompoc Valley Hospital, and there were a couple that needed ICU coverage, and they were moved to Cottage.
Cottage, okay.
But we don't have any right now. I'm on a lot of calls. We're the backup for them.
Okay. And for the lack of a word, their facility or their little hospital will be coming online when, in a week or two?
Yeah, Army Corps of Engineers was there last week, in my understanding, and they're activating it now. They will start with 22 beds, and we'll ramp up from there if needed. So the good thing is, for the future, I think they will be able to care for the community within the community there.
Okay. Thank you so much.
Well, good evening, Mayor Patino, council, staff, and viewing members. While we're pulling this PowerPoint up, I just wanted to give you a kind of a brief rundown and kind of answer Council Member Cordero's question. Since our last report, I just wanted to reiterate how often we as a department and as city staff were meeting. So we have our Emergency Operations Center being performed virtually. So 3 times a week, all department heads and their staff are meeting for half hour to an hour, reviewing what we're doing in the city, efforts that are going on, and then answer any questions and being able to collaborate some of the problem solving that we are encountering with this pandemic. So we're seeing a lot of good efforts there. And then to your question specifically, Mr. Cordero, we are seeing a few employees with mild symptoms, and if anything, family members that are having some symptoms, but very few that were reporting during those conference calls. So good news that we're not seeing widespread employees getting ill or sick, coming down with a sickness. Okay. Okay. I just wanted to show you again this dashboard on the public health website, publichealthsbc.org. This is from their dashboard, and it gives an up-to-date daily account and data of cases in the county. And you can see that yesterday there were 416 cases in the county, and just before coming to council meeting tonight, they updated their website, and so that number has increased to 429, an increase of 13 as of 5 o'clock this evening since yesterday. Santa Maria is leading the charge, I guess you might say, as far as cases in the county. We do have the biggest population. Right now we have, there was 101 yesterday, but of those 13 increases that we saw, 7 are attributed to Santa Maria. For the past 4 days, and now 5 days, the Santa Maria average has been just over 4 new cases a day here in Santa Maria, to give you some context. So you might have some questions about why we're seeing so many cases in Santa Maria versus any other city in the county. And here are some things I wanted just to highlight for you, in that we are tracking data through our GIS department here in Santa Maria, and it's very similar to what the county GIS utilizes. So we're getting that up-to-date information on information that we can use to help address this problem. Our PIO efforts, Public Information Officer efforts by Mr. Vannekamp and staff to the community has been going really well. We have heard from council that we need to have a focused effort towards our Hispanic and Mixteco populations. And so we are seeing that a lot of effort towards educating those areas. We are also spending a lot of effort towards our co-compliance and Rec and Park staff to educate and monitor various activities like laundromats, Costco, park activities, etc. There's been a lot of effort by our mayor on video messaging and addressing people about the pandemic and giving information about what's going on and what the city is doing. Things that we are doing to defeat COVID-19. Well, as you can see in the news lately, Governor Newsom has been talking about a 6-point plan, talking about things that we need to do to move forward from this pandemic. The ability to monitor and protect our communities through testing, contact tracing, isolating, and supporting those who are positive or exposed is his first point in his plan as we look at lifting shelter-in-place restrictions. The ability to prevent infection in people who are at risk for more severe COVID-19 is another focus. The ability of our health system to handle surges, and you heard from Ms. Anderson that things that we are doing, the hospital is doing to address any big surges that might occur. Governor Newsom also talks about the ability to develop therapeutics, to meet the demand of cases, and the ability for businesses, schools, and child care facilities to support physical distancing. And lastly, in this plan, the ability to determine when to reinstitute certain measures in case we see an uptick again in cases. As restrictions are lifted, we want to ensure that we are in step with the governor's plan. So, per Mayor Patino's direction, we are gathering a core group of community leaders that was referenced by City Manager Stillwell earlier to participate in a focus group on how we're going to do that. And I believe Mr. Morris from the Chamber is also going to talk more at length on that later. We want to be able to have a draft plan in place that offers insights and recommendations that the city of Santa Maria can consider as we look at, recovery efforts. And finally, I just wanted to share with you some good news or noteworthy events out there. First, we've been getting some feedback from our Rec and Parks Director about how grateful the community is that they're able to get out in the parks and exercise and still respecting social distancing. And that was a report that came out of the Santa Maria Times. So we're just really glad that the community is participating and responding and getting that good feedback. Secondly, there was a need identified by the food bank, and that they needed drivers to deliver food to those that are homebound and those senior citizens that could not get out to get the food that they need. So on one of our conference calls, we put that out to the department directors, and we had staff that stepped up and spent about an hour of their day last Thursday to deliver food. And we got some really positive phone calls and some messaging back. And I want to thank Director Housel's her efforts in the library staff that has basically manned phone banks for the food bank and helping in that effort to identify the needs in our community. And then lastly, I know Mrs. Anderson talked about an appreciation barbecue that we're hosting for Marion Medical Center, Police Department, CHP, Sheriff Officers, AMR, and other healthcare providers this Friday, just to show them that we care. We appreciate their efforts in getting us through this challenge. And so we're seeing a lot of huge responses in supporting that. We have a lot of people that have come in to volunteer, and a lot of donations as well to show their respect for what's going on in our community. So that's the end of my report, and I can answer any questions if you have any.
Question?
Yes, Ms. Waterfield.
Yes, Chief Champion, is there a list provided to the public of who distributes food and where they can go to get the food?
So I know the library staff receives phone calls and requests for food, and they pass that on to the food bank, and the food bank is the one that coordinates those efforts. If there's a need for, let's say, drivers to deliver that food, that is pushed out to all the communities. Like North County needs some help, and so then that goes out to the volunteers and the nonprofits that help, and that's the way I understand that support happens.
Okay, because a question was asked to me when I was doing the radio show on Friday morning, and I want to come in with an answer, and they asked, who are the people that do the distributing of food, or the location where you can go pick food up. I know there's nonprofits out there. I know there's churches out there. Our church fed 1,500 people in one day through their Angel program. So does anybody have a list of where people can call in and say they call the library, where can we go to get food?
So my understanding again is that request could go to the food bank directly.
Okay.
So once they make contact with the food bank, which could be some of our staff from the library, they would take that request and pass it on. Then that gets disseminated out to drivers. I think the food bank is the one that coordinates those volunteers.
Okay.
So if we have people, community members that want to participate and volunteer, to contact the food bank.
Okay, thank you.
They can also call 211.
Thank you very much, Chief Champion.
You're welcome.
Any questions?
Yes.
Soda?
Yes, I do. My question is regarding the four firefighters of our firefighters who were tested for COVID and they came back negative. How did we provide support to those firefighters during that time that they needed to be at home self-quarantining until their results came back? Regarding, how we were able to pay them during that time that they were not working.
Sure. So when those crew members came down with some symptoms, we identified that they needed to get tested. We sent them to IMG here to get that test done, we offered two options for the employees to follow. They could either quarantine at home while we waited for those results, or we could house them. And so they had an option of where they wanted to go. They all chose to quarantine at home. If they chose to quarantine, if we were to house them, then we would support them in any needs that they might have. And so that's the process that we would go through. And meanwhile, they are being covered under the Medical Family Care Act, Emergency Care Act leave. And so as far as the employee being supported, they're not even missing a beat from what they would normally see from a paycheck perspective.
Okay.
Any other questions? Oh, Dr. Moats?
I just had a question relative to physical distancing and people at risk. When I took a tour through the old Howard Johnson Hotel prior to the H2A people being introduced there, I went from room to room, and some of the rooms that had 200 square feet had 2 bunk beds to sleep 4 people, and some of the larger rooms had 3 bunk beds to sleep 6. So that's a lot of people really close to each other, and it would seem to me that would be a very high risk to get any infectious condition. I wonder, has anybody looked into that at all?
Yeah,
Mr. Silver?
yeah, that's Dr. Moats through the mayor. That's one of the 6 framework criteria you see that the governor had, and then Dr. Ferguson, Dr. Ritter, and the medical team have established guidelines on how to meet those. I believe there's 18 or 19 of them, and it includes things such as mitigating overcrowding, or if you are going to have that, to use PPEs, do testing, and those are going to be established criteria for us to demonstrate that we can meet the framework, maintain the safety, and then be able to allow the work to commence. And there might be some things that are easier to meet that threshold and the work can commence right away, and there's going to be others that are either going to have to do a workaround or a different way of providing service or adjust their business practices in some ways.
And I hear Dr. Moat's concern, because that's something that has been brought up to me numerous times from concerned residents about what steps we are taking to protect farm workers especially, and also, especially H2A workers, because of the challenges of being able to maintain social distancing while on the job, but also when they go home to rest. And so I would be really interested to see if the Chamber of Commerce has tried to reach out to any of the ag commissions. I know that I've been in contact with the Mexican consulate to see if they would be able to provide any support to the Growers Association or any of the ag commissions, at least to make sure that they are, that as many of the farming companies in Santa Maria are putting in place policies to protect the well-being of their employees. I know that they had an excellent roundtable in Ventura County where they were able to bring public health officials and again the ag commissions there to talk about that and put in place an action plan. But it'd be really interesting to see if that's something we would be able to implement here.
I know that Marion Dignity Health has been in contact with shipper growers and with some of the ag contractors here in town, and I can't remember a couple of other organizations. And so, but I don't know I just know they've been in contact with them and they've given them information and they've been working with them, but I don't know the outcome. Okay. Yeah. Okay, Mr. Stilwell?
I think that's probably a good segue question for Glenn. Thanks. So next we'll have Glenn Morris from the Chamber talking about the phased reopening and relief for businesses, giving an introduction, and then he'll hand it off to Suzanne Singh, Janet Silveria, and Terry Phillips, and to describe the relief efforts underway and the path to recovery.
Mr. Morris, you're on. Good evening, Mayor and members of the council. Thank you for the opportunity to join you again this evening. Ms. Soto, just quickly to make sure the audio was cutting out a little. if I understood your question, you were asking if we had any contact with the ag community around their needs and resources related to their employee safety. Is that correct?
That's correct.
Okay. Just briefly, we have been talking with the Grower Shipper Association, and I'll raise that question more specifically with them and get back to you on that, okay? So, Mayor, as you recall, 2 weeks ago, we spent some time sharing with you the strategies we were using to support our local business community. Tonight, what I'd like to do is enhance on that a little bit. We brought a couple of folks with me to help talk about resources that are available here and now for our local businesses. And then when they are done, I'm going to come back at the end and share with you some of the things we're doing as we begin to pivot to the recovery and reopening phases of this situation. So recognizing that one of our guests is joining us from a distance, I'd like to change the order if I could just a little and invite Terry Billups to speak first. Terry is the Assistant District Director for Economic Development with the Los Angeles region of the Small Business Administration. And so I'd like to introduce Terry to you, Mayor, and the Council, and invite her to talk about some of the resources that the Small Business Administration is making available. Terry?
Thank you, Mr. Morris, and good evening, Madam Mayor and honorable council members. I really appreciate the chamber and the city availing us some opportunity to talk about what's going on with SBA, and I know you all are experiencing firsthand the effects of what's going on with the pandemic, and I'd like to share some good news with you. I don't think we can get enough of that these days, but in the SBA's two programs, the Economic Injury Disaster Loan and also the Paycheck Protection Program, which was created as part of the CARES Act, SBA was able to issue 14 years worth of loans in 14 days, which is pretty incredible given the fact that, a little over 2 weeks ago, the Paycheck Protection Program didn't even exist, but yet we've been able to condense into that time 14 years worth of loans. So I'll share the state level loan numbers with you. Unfortunately, we haven't been able to get into the granular detail where I could drill down and actually tell you by county level or city what those numbers look like, but I certainly would like to share with you the numbers from the state because I think that that's very telling and at least tells us in terms of how much throughput there's been, where exactly we are. So I mentioned the two different loan programs, which is the Paycheck Protection Program, which that is the one that it has to be done through a lender, and then it's up to 100% forgivable. And that one was funded at $349 billion initially. So for that actual loan program that ran out of funding last week on Thursday, there was in total, so this is a national number, so in total for that, over 1 million loans. So the actual number was 1,035,086 loans valued at $247,543,393,521. And there were about 4,700 lenders that were actively lending as part of that program. So everyone, is waiting, and SBA and the Department of Treasury are urging Congress to add additional funding to this. We're hoping it's going to happen. So in the event it does, SBA stands ready to, again, partner with our small banks, community banks, credit unions, large national lenders to, again, help get this money out on the street to the small businesses. So for that PPP program, the national numbers I just mentioned to you, for the state of California, there were 54,922 loans valued at $20,853,495,045. So again, those were approvals through last week on the 13th. So again, we have a long way to go to get our small businesses back to where they need to be in terms of being able to open their doors and be viable and pick up where they left off. And we understand that, it's probably going to be a slow road. However, what we were hoping with the Paycheck Protection Program is that would give the small businesses the ability to bring back their staff levels to their pre-pandemic levels and give them the ability, if they met the criteria, to have that loan amount forgiven. So the whole intent with PPP was to get employees back on the payroll, back at their pay rates prior to the pandemic, and allow an 8-week period for these businesses to scale back up. So we're hoping that that's going to happen. We also understand that hopefully there's more money coming, which means we're going to be able to help more small businesses with that. And our office that covers Santa Barbara, Los Angeles, and Ventura County stands ready to partner with the city and help you as you try to support your business community to start to reopen and figure out what the next step is in terms of trying to recover. And then on the economic injury disaster loan side of things, so those were the two, again, the PPP, that was the one you had to do through your bank. And then the economic injury disaster loan is part of SBA's normal disaster loan program. It had a component which was new, which was called the advance piece. And again, this was up to $10,000 of forgivable money, and it was being advanced at a rate of $1,000 per employee to, again, help small businesses to be able to have a little bit of additional working capital before a loan came through. They were able to apply for both the EIDL and the PPP programs. So for the EIDL advance, so that was that up to $10,000 piece. In California, there were 114,980 loans processed, valued at $484,604,000. So again, that was just the advance piece of that loan. And then on the actual EIDL loans themselves, there were 6,820 loans processed at a value of $1,494,577,788. So a lot of money made it into the state of California. I wish I could tell you how much of that actually came into your county and, more specifically into the community. I think overall, it's great news for California. I think, we're doing a good job, but we need to do better. And particularly if this gets refunded, we need to make sure that not only the small business community knows to apply for these programs, but secondly, nonprofits and faith-based organizations, which typically don't qualify for SBA funding. So we're ready to help, and the Chamber's been a wonderful partner for us to be able to get the word out to small businesses, and we have the ability to reach them in Spanish as well. So we will continue our efforts to make sure that people understand how to apply, where to apply, any questions they may have, and to do it quickly. Because it's capped, we have to make sure that the folks are getting in the queue so that if the money runs out again, that they're already in process prior to that happening. So again, thank you, and thank you to everyone in the room, that's a first responder, and to the hospital for all the work that's being done. I know we're all having to work smarter and more efficiently, and certainly as public servants, I think, this is all uncharted territory for us. So thank you for all that you're doing.
Thank you very much.
Next, Mayor, I'd like to introduce Janet Silveria. Janet is the CEO of Community Bank of Santa Maria. I asked Janet to give kind of a local perspective on the work that they have been doing with our local businesses relative to the SBA loans, but also to talk more broadly about other tools that local banks have that they can bring to bear to support our local businesses during this time. So if we could, we'd like to turn to Janet.
Ms. Cordero.
I am here. I'm live. Good. Very good. Thank you, Glenn. Good evening, Madam Mayor, members of the council. Thanks for having me. So just to speak in terms of the various ways that we can help out our small businesses in our community, we have received, kind of regulatory guidance giving us permission to work with our borrowers to do loan modifications if they are impacted by the pandemic. So that's a pretty broad guidance, and most banks are cooperating with that guidance and doing whatever they can in terms of working with our borrowers to get them over the hump until they can get reopened and get back to functioning fully. That is something we did not have in the last economic downturn, which is why so many businesses were not able to recover after that economic downturn. This one's different. We're given permission to work with these borrowers and are given regulatory freedom to do so. So that's one thing definitely working in favor of our small businesses this time over our last economic downturn. Some other ways that we are able to help out not only consumers but business customers is that we are also waiving fees, any bank fees. We're waiving early withdrawal penalties. There's waivers of IRA withdrawals penalties from the IRS. If somebody needs to withdraw money and there's longer period of time for them to contribute that money back and make that up. I think the old standard was 60 days and now that's been expanded so that they can put the money back into their IRA that they withdraw during this period. So those are some other ways that we're helping with cash flow, that banks are able to help with cash flow, is to get some of those things out to our business customers. In terms of the SBA programs, just speaking, I know just for our bank, we're a community bank, we're a very small bank compared to the other institutions in the Santa Maria Valley. And just in our bank, we have over 36 million in process for the Paycheck Protection Plan. Some of those have been funded, some of those are waiting for this additional funding. But just to put that perspective, I mean, we are the smallest institution in Santa Maria. So if we're processing $36 million, there's a lot of money flowing into our community to help our small businesses. So that's just what we represent. That's our portion of that. I can't speak to what the other lenders, just like Terry, couldn't provide additional information on what other lenders are doing. Or what's specific to the Santa Maria Valley. That's the best I can offer you in terms of that. There is a new Federal Reserve Main Street lending program coming out. It's still kind of in the works. That's a $600 billion program. It's really, I think the initial intention really was that it meet the needs of the people who didn't qualify for the Paycheck Protection Plan. So it's still under that same sort of philosophy that they want these Main Street lending program loans to go to people who are going to use the money for payroll. And the Paycheck Protection Plan, they had to have less than 500 employees. So the Main Street lending program, they can have up to 10,000 employees. And there's also some additional requirements in terms of their annual revenue, but just to give you an idea, this applies to larger lenders. There isn't the forgiveness piece, but there are preferential loan terms. So it's a 4-year loan, the payments are deferred for a year, the interest rates are below current interest rates, market rates, ranging at about 2.5% to about 4%. They are subject to standard loan underwriting. The minimum loan amount right now is set at $1 million, but the bank advocacy groups are arguing to get that minimum lowered because there's lots of businesses that fit in that just over 500 employees that don't need $1 million. They don't need to apply for that. So we are fighting to get that amount lowered. So I hope that provides some additional insight into what the banks are doing, stepping up to help the community and give you a better idea of the assistance that's being put out to our business community. Thanks for listening.
Thank you, Janet. Any
Thank you,
questions?
Janet.
We have a question for you, Janet.
Yes, ma'am.
Ms. Soto?
Thank you. Hi, Janet. Thank you so much for providing that information. My question is regarding the loans that you all have helped process. What's the smallest loan amount that has been granted or that has been approved? I don't know if you would have that info.
If I heard you correctly, you asked what the smallest loan amount is that we've done?
Mm-hmm.
Is that correct?
Yes.
Okay. I think it's about $4,000 is the smallest loan that we've done.
That just speaks to me about the number of small businesses that we have in our community and how every dollar just goes a long way for them. And I can't imagine what some of these businesses must be going through if they're not the ones who received any of the approval, any of this funding because it ran out.
Any other questions? Okay, thank you very much, Janet.
Thank you.
Mayor, with your permission, next I'd like to have Suzanne Singh walk you through a kind of a sampling of the kinds of requests that we are getting through the Chamber and the Economic Development Organization. And just to want to give you kind of a sense of the types of things that people are reaching out for help, and then some of maybe the successes that we've had in connecting people to answers and solutions. So, Suzanne?
Good evening, Mayor and City Council members.
Good
Thank
evening.
you for
Good
the
evening.
opportunity to share with you our efforts during this current crisis. I'd like to share with you what I've been working on since the beginning of the crisis and answer any questions that you may have regarding these afterwards. I've made myself very available and have received quite a few calls, about 42 of businesses needing guidance or assistance and resources regarding issues related from the crisis with various businesses, such as items like eviction letters that businesses have received, unemployment denials, and issues that people are having in business are having with the EDD, Development Department, and the need for resources for additional assistance through that to navigate. Also inquiries about SBA loan programs and information. We've also had requests for Spanish-speaking needs regarding the SBA loans, and I think we've tried to target those and get to those individuals the help that they need. We've also helped some nonprofits in need of finding information on resources specifically for nonprofits. I also felt it was important to do a personal outreach to check in with all the businesses that I've worked with over the last 3.5 years that I've been here. So far, I've reached out to over 65 businesses, and that's not counting what the Chamber has done. That's just me personally. The Chamber's done more than that. These outreach calls were just to check in and offer resources and assistance to our shopping center owners or the management teams there, the town center mall, the manufacturing companies in the community, our school districts, our dealerships, Marion Hospital, Chumash, and even some of our smaller businesses I've worked with. I actually reached out to the bank to create a list of services that each bank would be providing for assistance for our businesses and provide contact information on our resource page through the Chamber. Some of the calls that we've been able to assist with were the dealerships needing connections for additional storage of their inventory of vehicles. The Chumash needed assistance with SBA and PPA programs and which financial institutions were going to be working in those programs so they could move forward on making sure that their employees from Santa Maria had the ability to stay employed. Santa Maria Railroad reached out to us needing help with finding personal protective equipment for their employees. They're having a hard time getting that, so we're working on that for them. A couple of examples of how great our business community is. Comcast and Santa Maria Joint High School are working together for connectivity issues. We have some students that aren't able to get access to the internet, so we've been able to put those two together, and hopefully they're working out some solutions. Marion and Saffron, you heard earlier, their Saffron is helping along with another company to repair masks. I think there was 175,000 masks that came to Marion that had rotten elastic. So we've been able to connect those and get those masks being produced so they can be used. And you'd heard Hardy and Saffron are working together. Saffron did some mold pieces for the test kits that Hardy is putting together. And then Mob Armor is another small company that's making face shields. In addition to all those calls and everything else I've done, I've actually been attending a lot of educational webinars just to gain more information, be able to direct and give resources to those people that do contact me. And those webinars are ranging from the SBA loan programs to the EDD and labor information to retail hospitality data, restaurant information, and then of course state, county, and regional gathering of information. So I've had the opportunity to speak with many local businesses and different ones, they vary, in the community, and we've been able to be a resource and a voice of calm in a stressful situation. Glenn and I have been able to offer some assistance and provide solution-oriented resources to assist them. These are trying times for everyone, and although they are difficult, I truly believe that our efforts have been helpful and well received. I thank you for your time, and I'm happy to answer any questions you may have.
Any questions? None? None. Thank you, Suzanne.
So, Mayor, that gives you just kind of a flavor of the work that we're doing on a regular basis here. I did want to also mention, Suzanne touched briefly on the Spanish language materials, and that's an area that I think in the last couple of weeks we really tried to step up our efforts. I know that Councilmember Soto and I have been in contact on a number of occasions, finding and sharing resources in Spanish that she's then able to then share within her network. We've appreciated her help in connecting us in those ways. And just over the weekend, Suzanne and working with a couple of our local business owners have put together what I'm going to call kind of a little tiger team of local business owners who have been through the process with the SBA loans and who have offered to help other businesses. These are all bilingual business owners, and so we're trying to marshal some additional resources right now for those owners that are more comfortable consuming the information in Spanish. Later this week, my chairman-elect, Edgar Gascon, is going to be recording a video interview with one of our local bankers in Spanish to talk about how the programs work and how the businesses can interface more effectively with the banks. So again, that's an area that I think we're trying to do a lot more work on. I wanted to just shift gears a little bit and talk a little more about what we're doing to prepare the community for when the governor and county public health give us at least partial permission to reopen our businesses and our community. We are working on a number of different fronts, partnering both with local teams as well as regional partners to identify strategies that we believe will help not only in the immediate opening, but more importantly in the longer phase recovery that our businesses will need to go through. Both the city manager and Chief Champion mentioned the committee that the mayor has impaneled, and we're honored to be part of that. For that local committee, we are in the process right now of developing a draft strategy document that is being circulated among a couple of local leaders to vet and make sure we haven't left anything out. And we'd be happy to share more details with you on that at your next meeting. It really focuses on 6 different phases of the cycle. The first is relief, which is the phase that we're in today. It then talks about reopening, which will be the immediate steps that we will take to educate, inform, and guide our businesses through the reopening process. Then it turns to recovery, which will be a longer phase of helping businesses to get back on firm footing. We then look at reinvention, which is, I think, going to be a really critical component for many of our businesses. Damage that will have been done is going to be significant, and the environment in which they're going to come back to work will be very different than what they knew before. And for many of our businesses, I think you've seen have reinvented themselves over the last few weeks, offering takeout options or curbside delivery. Shopping, the grocery stores have figured out how to queue people in a different way, to change the traffic patterns within their stores. Many of our other businesses that have been shut down will have to go through those same processes. And so we'll want to work with them to help them understand how to do that. And then the final phase is what we're calling resilience, which is really trying to look at what are the long-term economic strategies that we can employ in our community to strengthen the overall economy so that when we have future disruptions like this, hopefully not to this level at this speed, but when there are future economic disruptions, we'll be better prepared to handle them. Again, we're working on those kinds of plans with our local team, but also with our regional teams, so that we make sure that we learn from the best ideas that are out there. But also, we think it's important that, for instance, we're trying to encourage the two counties, San Luis Obispo and Santa Barbara County, to share some of their planning on the reopening component, is because we recognize that many of our businesses operate in both of those jurisdictions. And what they really need at this point is consistency and clarity, and not having to try to figure out which set of rules apply to which of their locations. I think, Mayor, with that, I would be happy to answer any questions you may have. Maybe just really quickly before we go to questions, Councilmember Soto, you also asked about where people can find a list of food distribution sites. We would point them to two resources. The first thing they can do, call the 211 helpline, and they can provide direction. They can also go to the Food Bank's website. It currently lists 16 locations in our community where food distribution happens on a regular basis. And I would note that those sites listed there do not include the schools. So there are probably a total of 20, 25 locations in our community where people can get help if they need food at this point. So with that, Mayor, I will stop at this point and be happy to entertain any questions that you or members of the council have. And I would say we appreciate your leadership and guidance and the help that you and all of the members of the council have provided us in connecting people who have questions or who we can be of service to. And so thank you for the opportunity to do that work.
Well, thank you very much, Mr. Morris. It sort of gives us an opportunity to get more creative, doesn't it, with everything. I wanted to ask, is Janet still on the line, or is she off?
I'm still here.
Oh, okay, Janet. How many SBA loans did you guys do here in Santa Maria?
In terms of the Paycheck Protection Plan loan?
Yes, Paycheck, yes.
We have over 200 applications.
200, okay.
Yeah, and again, we're a very small institution.
Okay.
We're the smallest. So, you need to extrapolate that up to higher numbers to represent the other institutions in town.
And how many more applications did you have on hand that you weren't able to give out?
I'm sorry, I didn't hear that.
How many other applications did you have on hand that you could not give out loans to?
I would really hesitate to answer that question. We're trying to address these loans with calmness and keep these folks optimistic that the funding is going to come through. But we have about half of our applications that have been funded.
Okay.
Or half of our pipeline in terms of dollars that have been funded.
Okay.
And the other half we're waiting for the next. the next group.
Okay, thank you. Okay, any questions at all? Mr. Morris, none?
Do you have one for Mr.
Okay.
Morris?
Mr. Waterfield, Miss Waterfield?
Glenn, you were giving the six recovery steps, and I couldn't quite hear on my end of it, but the first one was relief, the next one was reopening, recovery, reinvention. I didn't get number 5, and number 6 was resilience. What was number 5?
You had it right. Number 5 was reinvention. So the phases were relief, reopening, recovery, reinvention, and resilience.
Okay. Oh, okay, so I had them all. All right.
You
thank
had
you.
them.
And you're shooting, and you're talking with your group of people and the mayor's group, and you're hoping to have an answer by May 1st to open up May 1st, starting to gradually open up Santa Maria. Is that correct?
Councilmember Waterfield, thank you. So I would say that we're not focused as much on the when on reopening, because that's ultimately going to be a decision made at a pay grade higher than ours. What we're really focusing on is being prepared that whenever the governor's office and the county public health say it's okay to open some or all of our businesses, that we are prepared to help them through that process.
Okay, thank you.
Thank you. Any other questions, Mr. Morris? Okay, Mr. Stillwell?
Yeah, that does conclude our update for this presentation, the update for the coronavirus. So tonight we wanted to focus on the health science and then addressing the pandemic, and then focus on the business relief and recovery. And we plan to bring forward at the next council meeting another update with some of the key issues that we'll be addressing at that time.
Question, because okay, we got that list that was sort of broad and a little vague on essential services. Dog grooming. Okay, we have stores open that sell alcohol, and we have stores open that sell cigarettes, smokes, or whatever. Now, we were supposed to get a much more, a narrower scope of these essential services. I do get a lot of emails, and I could have missed it, but did you receive that?
No, ma'am, you did not miss it. We were negotiating with all the cities and the county on a agreed-upon essential service list. We have been told that it was sitting on the CAO's desk in Santa Barbara for the last 2 weeks. So by the time it comes out, we will be in the recovery phase. So I have several drafts of it, and we were endeavoring to be very specific for our businesses, but the code team that I work with has been out just trying to educate people on social distancing with whatever businesses are open, because the Santa Maria way is to lead the county, not wait for Santa Barbara to provide us information.
Do you have any recommendations for a strategy that I might use to get that list?
I'll be happy to provide it to at least the draft we have.
Okay.
During that reopening discussion, because again, I still think that Santa Maria looks at small businesses very differently than Santa Barbara does.
We look at a lot of things differently, but, I just think on dog grooming, why? To me, that's a business that should be open. We have, in Santa Maria, we can drive down Main Street, we can drive down Broadway. We see a lot of essential services open, and I'm glad, because that means that people, this is working people that live here in our community. And we know we want to open up, and we're going to do that in a very methodical and safe way, but I really question, and I've heard this question asked twice on national TV. Why do you have stores open that sell alcohol, and yet people can't, drive through a church in their car? And nobody seems to give an answer to that. But I don't see. Is there an answer on this one, on dog grooming? Because I don't, maybe it's something I'm not seeing.
Again, the difficulty is personal services are essential to someone. And, whether it's hairdressing, I happened to get a haircut the other day, not here, and I won't tell because someone would probably get in trouble. But we're endeavoring to keep as many people working in Santa Maria as possible. And so if there's an ability for us to educate, to assist in social distancing, and to provide safety for the customer and for the employees, we're endeavoring to do that. So I don't think there's a hard and fast list. There was, as you said, a overarching review of essential items from the governor's office based on a very different perspective of what is important than a community such as ours. And so we've endeavored to interpret that in the code division particularly as broadly as possible to keep our people working.
Thank you.
Consistent with the best public health we can do, and we'll continue to do so.
Thank you. Dr. Moats.
Yeah, I had a question, Mr. Watson. Is there a mechanism in place for whatever authority to shut down a business in the city of Santa Maria if they feel that business shouldn't be open?
Again, the legal authority is through the Public Health Department, who has the ability to require in a time of infectious disease or pandemics, but that would normally be enforced through either the police department, the sheriff's office. The code division obviously doesn't have that level of authority. We have administrative citations, that sort of thing. But generally, a public health order is enforceable by criminal penalty through a sheriff's or police department. However, the district attorney has been quite specific in saying that they will not be processing criminal-based orders along those lines, at least not in Santa Barbara County.
The answer is no.
The answer is there are criminal penalties that can be asserted.
That's what the attorney said.
However, that has not been the Santa Maria way.
Mr. Morris? Mr. Morris had something else he wished to say.
Yeah, Mayor, if I could, you mentioned the dog grooming situation, and I wanted to highlight that as an example of what we've been trying to do to help businesses. So, in this particular case, the business owner interpreted the rules to say that she shouldn't be open offering grooming services. And while I don't think we would have interpreted them exactly the same way, that was how she was interpreting the rules. So what we did is we tried to help her understand different ways that she could still continue to serve her clientele. So, we talked about things like she could do, mobile grooming service where she could go to people's house and, with an appropriate distancing, groom the animals there. We talked about the fact that maybe she could offer lines of food, of pet food, which I don't believe she had done before. So again, this is just a good example of how we're trying to help businesses reinvent themselves so that they can continue to operate, bring in revenue, and serve their customer base. And then I also want to thank Mr. Watson and his team for the perspective he just outlined. I don't think every community is trying as hard as Santa Maria is to keep people working. And I, for one, on behalf of our businesses, want to thank the council's leadership and Mr. Watson's implementation in that regard.
Thank you, Mr. Morris. I wasn't speaking to anyone particular when I was speaking of the dog grooming. I had just heard it on the Board of Supervisors, and I thought, gee, that's strange. I don't take my dog to get groomed, so I didn't know that was even an issue, and I just thought that to me, it just seemed strange. So, thank you. I want to read this letter. I received a letter. and I don't need to give you the names, is I'm an older woman, and I've been going to stores, Walmart, CVS, Food Co., Smart & Final, and Albertsons. The women protect themselves much more than the men. And this was about 7 days ago, but lately, not even the women are covering their mouth and nose. The groups are large and no precautions. I do cover my mouth and nose and wear gloves. What I ask of you, Mayor Patino, is to encourage people to wear protection to keep from spreading the germs that can spread fast. I'm sure you will find a way to do this to save people, sincerely. So it's been said, a lot of people out there are afraid, and I'm so glad we had Dr. Ferguson tonight and Sue Anderson to let us know what's going on in Santa Maria to maybe alleviate some of those fears that we're not as bad off as some people might think we are. Ms. Soto?
To that letter, to the letter that you just read, I'm curious. I know that the public health department has recommended face masks, right? And I've also heard that complaint that not enough residents in the city are complying with that when they're out in public.
The public health department from the county of Santa Barbara has not, because I asked them pointedly in a meeting, 2 days ago, 3 days ago, I can't even remember, 3 days ago.
They're not requiring it? Is that what you're saying?
Yes. I don't even think they went as far as they say we recommend it, did they? In that meeting we were in?
It's as far as the recommendations of the social distancing and PPEs, with face masks being a part of that. And we do see some of our businesses requiring it, probably because of their own business policy, or because of maybe they have employees who are sensitive receptors who work there.
Yeah. And then I just wanted to read part of this. And I'm just going to read part of this letter. It's rather lengthy. We're pretty elderly, so we stay in place, and so many times I hear of packed stores with adults and children, kids at the beaches playing basketball, skateboarding in large numbers. How can we ever hope to stop this pandemic if our leaders at the very top don't caution citizens of the dangers in leaving their homes and putting themselves and others in danger? I'm sad to hear that I hear downtown Santa Maria is daily overrun by our citizens, and most of all, by people that I know happily shopping without a care in the world. So, anyway, I just wanted to, and another thing I wanted to show you, I get these warn letters, and we get this and these are letters that come to our office from different companies, and a lot of them we'll be getting more, and there's probably more that came in today, to let us know that people are being laid off and furloughed from jobs. And this is just part of what I have. So, there might be 26, and they give you the number, 26 and 58 and 37, and it goes on and on and on. So, any other comments from the council? Okay, if not, Mr. Stillwell, any comments? And thank you, Mr. Watson. Appreciate it. But I will get the draft from you. Thank you. Okay, next order of business is, staff report. Let's see, Madam Clerk, can you read that's item number 5, the agenda?
Yes. As to the public hearing for the weed abatement program, the weed abatement program public hearing item is continued to the meeting of May 19th, 2020. Additional noticing will be provided. As to 5B, our next item, the City Council will consider proposed changes to the 2019-2020 Annual Action Plan in order to help fund the Good Samaritan Shelter and its COVID-19 efforts.
Okay, are there any questions from the council? Are there any requests to speak or written? Any written correspondence, request to speak?
No, Madam Mayor.
Okay.
If not, Madam Mayor, I'd like to make a motion.
Rosie has a presentation.
Oh, okay.
Okay. And Rosie has a presentation. I didn't see her here, so I didn't think she had a presentation. Okay.
Yeah,
Okay.
just take a moment as we get the PowerPoint up, and we do have staff here for the quick presentation, public hearing, and it is related to the item we talked about last week, so I believe it should be relatively quick, but we're here to provide the information and take any questions that the council may have.
Okay.
Rosie, are you there?
Yes, looks like I'm muted.
Not anymore.
Oh, okay.
Yeah, and you have control of the board.
Good evening, Madam Mayor and members of the City Council. We come before you tonight to ask that you adopt a resolution approving an amendment to the action plan for fiscal year 2019-2020 for the use of federal funds under the Community Development Block Grant Program. There we go. Every year, the City Council adopts resolutions approving the annual action plan for the use of federal funds under the CDBG program as required by HUD. According to the city's adopted citizen participation plan under CDBG, if there is a change in the use of funding or there is a substantial change in the amount of funding allocated, a substantial amendment to the action plan is triggered. This usually calls for a 30-day public review period, but because of COVID-19, we've been able to expedite, and HUD has allowed us to do a 5-day public review period. So the substantial change, as you can see on the screen, is as follows. We are recommending that public service funding in the amount of $10,212 left behind by Coast Valley Worship Center to Good Samaritan Shelter be reprogrammed to Good Samaritan Shelter. Coast Valley Worship Center originally received a CDBG public service grant in the amount of $10,212 to provide therapy support to adolescents involved in the criminal justice system. But a few months ago, the agency informed city staff that it was unable to meet certain CDBG contract requirements and would not be using the funding. The city was initially going to reprogram this funding for future use, but due to COVID-19, the city felt it was necessary to reprogram these funds as quickly as possible and fund the agency that is feeling the effects of COVID-19. The reprogramming of these funds will not affect the allocation amount adopted by the City Council a couple weeks ago. Repurposing the funds now will allow Good Samaritan Shelter to utilize the funding immediately. This is not part of CDBG CV that the city is expected to receive to assist with COVID-19 related activities and programs. City staff is currently working with the city manager and HUD to determine the best use and allocation approach for that funding. Once a plan is in place, it will be subject to a 5-day public review period and will be presented to the City Council for approval. This concludes my presentation. Thank you.
Any questions of Ms. Rojo? Okay. Do we have any requests to speak or written correspondence?
Madam Mayor, we have no request to speak, but I had one written communication that was received from Fighting Back Santa Maria Valley supporting the item and Good Samaritan Shelter. This written communication was previously emailed to the council, posted on the agenda on the city's website, and copies have been provided at the dais.
Thank you. I open up the public hearing. Any other comments? Hearing none, I close the public hearing.
Madam Mayor, I'd like
Yes.
to make a recommendation to adopt a resolution approving the amended annual action plan for fiscal year 2019 to 20 for the use of federal funds under the Community Development Block Grant CDBG program.
I second.
I have a motion and a second. to adopt the resolution approving the amended annual action plan. Any other discussion? If not, Madam Clerk, could you please call the roll?
Councilmember Waterfield.
Aye.
Councilmember Soto.
Aye.
Councilmember Cordero.
Aye.
Councilmember Moats.
Aye.
And Madam Mayor Patino.
Aye. Next, we have a regular business item. Madam Clerk, could you please read the title?
The City Council will consider expanding the city's cooperative purchasing program to all public projects.
Okay, the staff report is to be made by Director of Public Works. Mr.
Actually, I'll
McKee.
be making that, ma'am.
Okay,
The reason for this change, and it literally is a technical amendment, was my office in conjunction with the IT department identified a flaw, a limitation in our current code that limited cooperative purchase agreements that we normally could piggyback on, such as state contracts or contracts with other governmental agencies, to items under $60,000. We had the potential of buying a number of pieces of computer equipment on a very quick turnaround, but because of the limitation, the dollar limitation and the time limitation, we felt an expansion of this activity and to spell out precisely those other entities for which we could piggyback, other cities, counties, nonprofits, the joint powers agreements that we had that are identified in here. We felt it was important to expand that capability so we can be more flexible in our purchasing. It is something authorized by law. It does not change our underlying requirements for competitive bidding as appropriate for public work projects, but it is something, for instance, if we needed to buy in a rapidly changing world such as this, a group of PPE equipment that would be more than $60,000, we have now the flexibility to do that. It really, like I said, it stemmed from that IT issue. It became something that Public Works looked at because there are competitive and cooperative items that they can do. If there's a Caltrans contract with an asphalt manufacturer or some other kind of manufacturer. So those sorts of things, we felt it was an appropriate expansion.
thank you. Any questions of Mr. Watson?
I
Ms. Soto?
do. And can you reaffirm that this will not affect current bidding the way we do the way that we bid for our project?
To the extent, this does not make any change to the process. This makes a change to who we would be potentially able to contract with if there's a pre-existing cooperative contract that has already been competitively bid, but we want to piggyback on. And it's mostly for either speed or pricing, because that's typically the elements that the state of California can buy more police cars than the city of Santa Maria, but we could still piggyback on some of those, or computers or other fungible types of items. So there would not be a change to public work bidding for projects.
Any other questions? Any written communications, Madam Clerk?
Madam Clerk, not on this item. Madam Mayor, not on this item.
Okay. Okay. Then I am ready to hear a motion.
Okay, Madam Mayor, I'd like to introduce an ordinance for the first reading and continue to the next meeting for a second reading of the adoption amending Section 3-4.13 of Chapters 3-4 of Title 3 of the Santa Maria Municipal Code governing bidding procedures.
Is there a second?
I'll second.
It's been moved and second. Any further discussion? If none, Madam Clerk, can you please call the roll?
Councilmember Waterfield.
Aye.
Councilmember Moats.
Aye.
Councilmember Soto. Councilmember Cordero.
Aye.
Madam Mayor Patino.
Aye. Next item will be a report by City Manager, Mr. Stillwell.
Thank you, Madam Mayor and members of the council. So the next meeting of the City Council is on May 5th, and again, we're working to keep the agenda light as we're addressing pandemic issues and adjustments to many of the activities in Santa Maria. So we'll try to keep the primary item again as another COVID update. We'll work to have, I've heard a number of questions that the council's had at both of our presentations about public health orders and the county's plans, so we'll work to have county representatives here. And then we'll, again, have the chief providing an update on the coordination efforts. And We have a few proclamations for Water Awareness Month and Public Service Recognition Week, and that concludes my report.
Thank you. Okay, oral reports of council members. Dr. Moats, shall we start with you?
I have nothing to report, Madam Mayor.
Thank you. Ms.
Madam
Waterfield.
Mayor, the only thing I have to report is doing the Rick Blameyer show on Friday mornings, and that's it's been a hoot.
You've been having too much fun.
I have been
Yes.
having a great time, so I'll be doing that again this Friday, too. So thank you very much.
Ms. Soto?
No reportable items for me, Madam Mayor.
Mr. Cordero?
Thank you, Madam Mayor. Just that I did the Ben Hayes show after our last council meeting, and I've attended several of the webinar meetings, but other than that, nothing more.
Thank you. April 8th, I did a webinar with CalPERS, and I think Mr. Stillwell was on that, and they are living in a different world because their whole attitude is, well, if you feel like you're in, dire financial straits, then maybe we'll take this on a case-by-case basis, and we might help you out. And it was pointed out that other cities were in the same boat. They were all saying, well, they'll still do it case by case. Later that day, I did the Santa Maria Key Leaders Update teleconference, and it's pretty much, it's key leaders in the city of Santa Maria and pretty much people that are speaking, that coming to our meetings and speaking and updating us here. On April 9th, I did this is all teleconference, Santa Barbara County Legislative Briefing, and that's with the County of Santa Barbara. And then you have all the mayors and 2 of the supervisors. There's usually someone from Diane Feinstoff's office, never anyone from Harris's office. You have our assembly people, Limon and Cunningham, and you have Hannah Beth Jackson is always there, and supervisors and the mayors from the county, and talking about what's going on in their communities. And so we get a good idea of what's happening in everyone's community. April 10th, I did the Rick Blameyer show, and then that afternoon, there was a briefing from Assemblyman Cunningham. April 13th, did the special meeting of the Monterey Bay Community Power Policy Board. That was also teleconference. April 14th, no, I missed that one. April 15th, the Santa Maria Key Leaders Update. Again, the key leaders, we telecommunicate once a week, and it's on Wednesday afternoon. April 16th, I attended the monthly SBCAG board meeting, and some of us from the county were up here at the Board of Supervisors office, and some were down in Santa Barbara. And we're all social distancing. Had a meeting about city finances during the COVID. This was a webinar. And did the Santa Barbara County Legislative Briefing teleconference. Again, that's with all the county, and public health is sort of running the show for the county, and then they talk about, there's different people, the sheriff is there, and like I said, we have all the mayors there and representatives from the county. April 16th, April 17th, did a briefing teleconference with Assembly Cunningham. On the 18th, which was a Saturday, I did a density on housing teleconference for community leaders and officials, and this was throughout the state of California, and I think they had about 120 people attending, and it was about a 2.5-hour meeting. And Monday did the Santa Barbara County Legislative Briefing teleconference, and this morning I did the Ben Hayes show, and that's about it. A lot of meetings on the teleconference. I haven't figured out how to use the Zoom yet. I mean, I get all the way there, but I just haven't been able to finish it up. And that's okay, I turn on my phone, I know how to work the phone. Any other comments? Okay, if not, this meeting is adjourned.